Hey everybody, this is Dr. Zarina, also known as Dr. Z, your sports medicine, integrative medicine specialist, here to help you rebound your health and ultimately attain pain freedom. Today I want to do an impromptu Tuesday tip, and today's tip is vitamin D3. We've talked about this, my MVPs, maybe some weeks ago in the past, and we kind of inserted it into a longer video, but today is just a quick tip. I wanted to remind you all out there to make sure that you are supplementing if you're not getting enough. So quick facts I wanted to read off to you. 75%, okay, over 75% of people of color, that's not just African Americans, that's Latinos, people of Mediterranean descent or anything to that effect, people with melanin in their skin, over 75% of us are deficient in our vitamin D. And then 50 to 70% of our children, teens and children, regardless of their melanin in their skin, are also deficient in their vitamin D3. Of course, you may ask yourself why. Why is what I'm about to tell you now about the people who are most at risk for being vitamin D deficient. And one of those is the lifestyle, okay? Lifestyle was one of them that kind of reflects more with our children, regardless of the melanin skin. They have a more of an indoor lifestyle, especially in the good old USA, all right? That's one risk factor, is the indoor lifestyle. Other thing is having melanin in our skin. The higher the melanin content in your skin, you're actually going to have a reduced synthesization of our production and synthesis of that vitamin D3. Okay, so that's really important, a piece of that as well. And then if you have a lot of clothing that you're covering a lot, some of my hijabi sisters out there, so that may be also a quote unquote risk factor for having lower levels of synthesis of vitamin D3. And then we talked about the indoor lifestyle, okay? And then also as we age, we produce or less vitamin D3. So that's a good point right there. Let me start right now. Hey, welcome to the broadcast. Welcome to the broadcast. This is Dr. Z. Hey, come on into the room. When you come into the room, go ahead and say hello. Hello. Okay, and then I'm moving on. Then also in general, what I wanted to guys let you know that with the difference between the vitamin D3 and vitamin D2, just the way they're synthesized and production of them. Vitamin D3, if you're going to supplement, is a little bit more potent than vitamin D2, okay? So who's my most at-risk athletes, for instance, or just use athletes for example. My most at-risk athletes are my indoor athletes, such as my indoor swimmers, my gymnasts, and my basketball players. Those are the ones that are going to be most at risk for having vitamin D3 deficiency, okay? And we're going to talk about ways to improve that. And then also in general, the best way to get supplemented with the vitamin D3 is fatty fish, sometimes milk, and then of course the sun is the biggest producer of that. But since again, as I just related to about our lifestyle, we typically don't get enough of that. So I oftentimes, myself and many experts, will recommend you take a supplement of some kind. And that supplement, again, could be vitamin D3 or vitamin D2. My vegans out there, you might want to do the vitamin D2. They tend to be, the way they're produced is not with any animal product. So if you're vegan, you might want to opt for that. But vitamin D3, honestly, is the most potent. And then there are some versions out there that are kosher for my Jewish MVPs, or my Muslim MVPs are also halal versions out there, or halal, meaning that there's no pork casing or pork capsulation over there. So my Jewish MVPs, my Muslim MVPs, Christian, whoever you are out there, there's options for you too. Don't feel like, oh, well, I can't have this, I can't have that, I can't get adequately supplied with the vitamin D3. Not true whatsoever. Hi, welcome to the broadcast. Say hello. Welcome to the broadcast. It's Dr. Z, just giving you guys some quick Tuesday tips about vitamin D3. Again, just really pressing upon because I keep seeing this in my office. So I feel like I need to repeat this and not assume that everybody understands and gets it. So those are the most at-risk individuals. And of course, please hit the replay because this won't be a long video whatsoever. Okay. And then what does it help? What is the point of the vitamin D3? Why am I pressing upon it that it's so important? Well, at the end of the day, what I deal with on a day-to-day basis in my clinic is pain. And so it does indeed help pain. The research out there is sound, and the research out there supports that it helps with muscle recovery. It helps with muscle building. It helps with bone fracture prevention. It helps with bone healing. It helps with myalgia pain. It helps with decrease inflammation. And an example I give for my athletes that are listening to me out there is that There's been shown the studies with the overtraining. If you're doing a lot of overtraining, or you was trying to get a real hard training, you have that that burn or that pain that lingers on afterwards because you kind of overdid it, overuse injuries, for instance, even. Then vitamin D3, when you're adequately supplied with vitamin D3, it actually has been shown to reduce the incidence, reduce the duration of that kind of pain that happens further following, such as overtraining, or when you're training real hard or you're maxing out, so to speak. So that's important too from a symptomatic perspective, right, is what I'm getting at, that vitamin D3 has been shown to help with symptomatic pain, as well as in general with the bone health and muscle health as well. So that's really critical. If you're not supplemented or sitting over in your counter somewhere in your cabinetry, and you're not using it, pull it out, pull it down. What do the experts recommend? We typically recommend somewhere between 5,000 to 6,000 international units a day, kind of depending on how deficient you are, okay? Or what, if you just went through a major injury. But either way, at least 5,000 to 6,000. Don't take anything less, because it's not going to really help you as much, and you won't get the biggest bang for your buck. And then typically in my office, we'll recheck your levels about 3 months in to determine where your levels at that point, and then determine if we need to do another cycle, or if we're at the point of getting you on a maintenance dose or whatnot. Again, this is something so easy, guys. It's not actually super, super expensive, to be honest with you, but we want to optimize your health at the end of the day. All you are listening to my voice, you're my MVPs, you're your own MVP. It doesn't matter if you're an athlete, elite athlete, amateur athlete, or athlete at heart. Just want to optimize your health in general. This is really, really helpful and really, really critical information. This is your Tuesday tip with Dr. Zarina. I'm Dr. Z, as you know as well, here to help you rebound your health, ultimately obtain your pain freedom through my different programs, such as my medical practice, my concierge practice, consulting services, telemedicine, and other programs and products and services to come. So see you guys later. Have a great week. Get on that vitamin D3. Get your levels checked. You can either reach us at info@drzarina.com for more information, or follow us on Facebook at www.facebook.com/Dr. Zarina. That's DRZARINAH. So that you get more information about how we could potentially help you too at Rebound Sports and Rehab through Rebound Integrative Medical Group. Have a great week. We'll see you guys later. This is Dr. Zarina signing out.